Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. In our series on ESMO, we'll be speaking with Dr. Nicolas Girard. He's going to give us some insights and the primary results from PAPILLON. Welcome to Health Professional Radio, Dr. Girard.
Thank you for the invitation.
I understand that you're a thoracic oncologist.
Yes, I'm working at Institut Curie in Paris. I'm the head of medical oncology there. We have a strong group for the treatment of patients with lung cancer, and we had the opportunity to participate in the PAPILLON study.
And how long have you been practicing?
Well, nearly 17 years now.
And was this your first love going into medicine?
You know, when I was a medical student, I had a rotation in a respiratory medicine department. So this was where I met patients with lung cancer, mesothelioma, and this is something that raised my interest. And at the time I began my residency, it was a time when the oncogenic alterations were discovered in lung cancer, opening the era of targeted treatments and precision medicine. So it was a time where for the first time in lung cancer, we had new drugs and better survival of the patients. So it was a time when everything started for the management of patients with lung cancer with a modern treatment, and I was there. So this is why I started to focus on lung cancer.
Provide us a summary of the PAPILLON data that was presented at the European Society for Medical Oncology 2023, including any pertinent background information, if you would.
Sure. So PAPILLON is a randomized study that was conducted for patients with EGFR exon 20 insertion mutations, which is an uncommon group of patients with rare mutation. EGFR exon 20 insertion mutations correspond to something like 5% of patients with EGFR mutant non-small cell lung cancer. So at the end, this is 1 to 2% of patients diagnosed with non-small cell lung cancer. This is an aggressive disease. This group of patients usually present at the time of diagnosis with multiple metastases, and the common EGFR inhibitors are not working for this disease. So this is a high unmet need. We have seen over the past years some drugs that have been developed for the treatment of these patients in the late-line setting, and this includes Amivantamab, which is a bispecific EGFR MET antibody, leading to a deep inhibition of the EGFR signaling pathway and covering these mutations. So the objective of PAPILLON was to assess Amivantamab plus chemotherapy in the first-line treatment of these patients. So PAPILLON randomized these patients between Amivantamab plus chemotherapy versus chemotherapy alone, followed by Amivantamab in the second-line setting for patients showing disease progression. This is more than 300 patients, and the primary endpoint was progression-free survival. The PAPILLON study met its primary endpoint with a reduction by 60% in the risk of disease progression with Amivantamab plus chemotherapy versus chemotherapy alone. In terms of median, this is a median PFS of 11.4 months versus 6.7 months. So this is highly significant, clinically meaningful, and these data support Amivantamab plus chemotherapy as the new standard of care. And obviously, the PAPILLON study is continuing. We are still following these patients to get some data on overall survival for sure. We have a tendency towards a benefit in terms of PFS2, which is the time from randomization to second disease progression. And here we have a reduction of the risk of progression in terms of PFS2 by 50%. So at the end, despite the fact that we had this crossover in 2/3 of the patients in the control arm, we really believe that the combination upfront of amivantamab plus chemotherapy is providing a strong benefit to this group of patients.
Were there any special or new methods implemented conducting this research?
Well, this is actually a pretty straightforward methodology. This is randomized study. It's an open label study. This is why PFS was assessed by a blinded independent central review committee. But there is no really innovation in the design. I have to say that including the crossover in the control arm was something very good for the patients who participated in the study in terms of ethics in research. But for this study, pretty straightforward design, no complexity, and this is why these positive results, this also adds to the value of these positive results.
Give us the main takeaways of the study and any significant research that you'd like to add.
This is a new standard combination of amivantamab plus chemotherapy for the first-line patients with EGFR exon 20 insertion mutated non-small cell lung cancer. This leads to have the information about this mutation status before choosing the first-line treatment. So it means that patients diagnosed with metastatic non-small cell lung cancer absolutely need to have this NGS, next generation sequencing assessment of the biopsy specimens before starting the first-line treatment. Otherwise, we will miss the opportunity for these patients. So full NGS for all patients diagnosed with non-small cell lung cancer. We have a new standard for this subset of patients, and obviously the study is continuing with assessment of overall survival as well as other subgroups of patients, for example, patients with CNS disease.
Dr. Girard, thank you so much for joining us here on Health Professional Radio.
Thank you for the invitation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Nicolas Girard. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.